So, very warm welcome to you in the audience. Welcome to this Computerwoche webinar, how IT platforms leverage healthcare services, linking care providers into patients made simple, safe, and easy. This is our promise, and we want to discuss how healthcare, medical, and rehabilitation service providers may leap into building sustainable, efficient, and safe infrastructures for transporting data from the world of things. Our keynote speaker today will show you in detail how healthcare providers, for example, a clinic, is now able to help patients easily with new telemedicine services. But what's the biggest pain point today, especially for you as IT specialists who want to help their organization to deliver high quality services to patients? Improving post-discharge care management, the coordination of a medical team and the patient's follow-up treatment, and optimizing patient management costs. All these are critical areas for every healthcare provider. And if we step further into teleconsultation, telereporting, telediagnosis, telemonitoring, ensuring the privacy of personal data and cybersecurity help to minimize the need for patient movements, we are in the middle of our topic today. And I'm very glad that we have a specialist here from Italtel, and a very warm welcome to the technical marketing engineer there at Italtel, Stefano Livraghi.
Hello, everybody. First of all, thanks all for joining us in this webinar session. So what we are going to talk about is related to the healthcare market and the healthcare solution we provided for this specific segment. So just to let you know, here is what we are going to talk about in our webinar today. So I will show quickly an overview of our company, Italtel, with shortly the history. So where we come from, which are the main products we have, and where we are going to. And then we will go deep in detail in our solution that is meant to address the healthcare market. So all the characteristics, all the features, how it works, which is the promise, which are the main driver on which the solution is based on. Then we will have a look on our use cases and our success story and all the main activity we are working on with Dr. Link. And then a look to the future in order to let you know what we have in mind in terms of evolution. So I would suggest you to, if you have any kind of question, do not hesitate, so that you can even help us in doing a best presentation. So few words on our company. Italtel is a company that is on the market since almost 100 years, with a combination of different product, solution, and also professional services. It is based on 8 different offer lines, and clearly our history is strictly connected to the telecommunication world. So we come from that world, and what's going on is that we are moving step by step since different here on different market, addressing different verticals. So starting from the telecommunication and then moving on public sector, defense, finance, healthcare, providing both product and solution and also professional services. Italtel presence in the world. Italtel is made of 1,300 people, and among these one, almost 40% of them is dedicated to the R&D department. So we have customer, and our main customer till now are the most important service provider in the world. So we are covering almost all Europe, and then we have a strong presence in South America. Here is a snapshot of our product catalog. So here you can see that most of the products that come from our history are designed to help a service provider and different customer address their need in terms of telecommunication system. What's going on is that in order to address different markets and in compliance with the new technology, we are working also on the new stuff related to, for example, Internet of Things and the contextual communication. Here, for the contextual communication, is where we put our solution that is designed to manage the healthcare market. His name is Dr. Link. What we are talking about, Dr. Link is one of the vertical addressed by our product. That is a software-only product that can address different vertical, and among these one, the one related to the healthcare. So we define it as an open platform because one of the main drivers that we use designing this solution is starting from the assumption that we need to collect requirement that can come from a doctor on one side, from patient on the other side, and from people that are taking care of the technological part or of the hospital or the caregiver. So the idea is providing a solution that is able to ensure a continuity of care at home for patients. So the idea of discharging and dismissing patients from hospital, letting them enjoy the pleasure of their home, while having the caregiver the capability to control them, to monitor them, to stay constantly in contact with them. So I talk about the product. Italtel is, I would say, more known in the world because it's from that point that we start. So we carry all the experience we have in this job inside this different domain. I said, and here is written, open healthcare platform, because you need to be able, on one side, to satisfy the needs of doctor and patients in terms of requirements. So it has to be flexible in order to easy add new functionality on one side. And I mean open because we consider that we are deploying this product and this solution inside a domain where some third-party platforms are already there. So open means that this technology that is based on WebRTC need to be easily integrated in a system that is already there. It means with this product we are providing open API so that easily the solution can be interconnected with, for example, clinical folder that is already in place to the caregiver.
Yeah, Stefano, and how far is that improving the patient care for healthcare providers?
Yeah, the idea is exactly this one. So I said the benefit from the fact that patient is at home, while on the other side providing, for example, video communication in HD definition with an easy way to connect, simply dismissing the patient with a standard tablet and allowing them to establish a video call in HD definition with one tap only, meaning reducing the distance between the hospital or caregiver more in general and the patient that is located at home, so that patient and doctor can see each other. And so it's like to be in the hospital without having all the issue you can have staying there. So the idea is to reduce the distance between doctor and patient. How it is reached this one? So I said we have mainly three different sides. We have the doctor side. So inside the hospital, they should be able, and with this solution it is the case, to contact directly the patient easily with one click only and establish a video call directly inside a web browser. So one of the flexibility points I was referring to at the beginning is related to the fact that this solution do not require any hardware specific and do not require any software specific to be installed, neither in the hospital or in the house of the patient. The idea is using the WebRTC technology to perform a video call directly inside a web browser. So on the hospital side, the only requirement is to have whatever operating system able to run a web browser like Chrome, Firefox, or Opera. And inside the web browser, we will perform all the services that can keep in contact the patient with the hospital. I'm talking about video call. I'm talking about the capability to perform chat with the patient, the capability to monitor the therapy that the patient is following, the capability to ask a patient to fill some questionnaire. So here we will see in the next slide all the capability that the solution provides today. Of course, this solution is meant to improve the patient care in all phases, because on top of the fact that he will enjoy his house instead of being in the hospital, it will be part of the process in order to help himself, for example, be active in following the therapy.
So it's, of course, Stefano, before we talk about the contextual communication management provided by this Dr. Link solution, there's a question from a participant. How do you handle bottlenecks with the bandwidth? So when the patient is hanging on a sensor data device at the end. So when he is at home, he is not in the clinic, and maybe there are some problems with this bandwidth.
Okay, so let's split it into the answer. The first one, I talk about WebRTC technology. There's a reason why we select this technology. One of the reasons, it was the flexibility and the openness I talked at the beginning. The second one is because this technology is using to establish the video call a specific and dedicated codec. And this codec, by the way, is able to save at least 40% of the bandwidth. What it means? It means that with the same bandwidth and with a classical video codec, with this one, I'm able to provide 40% more in terms of quality. So just to give you an example, on the YouTube platform today, we have thousands of billions of hours of video that are recorded and provided leveraging this codec. So the first way to manage this one is pick up and select the right technology, and we did it with WebRTC. The second one we will see later on is, and this is a specific need that we are addressing with our proposal, is to somehow put far from the doctor and from the patient the complexity of the technology. So you will see later on, and if you don't mind, I will address this answer in a few minutes, that we think and design a specific platform within charge all this kind of monitoring. I mean, the monitoring, for example, for the coverage area, the question comes from, because we are referring to the fact that maybe there is not a good quality in terms of coverage area where the people is located. Just to be clear, solution is not linked with the type of connection, meaning this tablet with a dedicated app can work either using the home Wi-Fi of the patient, or it can use a dedicated SIM card to leverage a mobile network.
All right. So what about line failures?
Sorry, I didn't catch it.
What about line failures when the net is not working? So is there a fallback solution in that?
Okay, yeah, the point is this one. With the platform that you are going to see, we are going to monitor such kind of fault. So we are aware that one specific tablet that is located in one specific place assigned to one patient is not anymore under coverage area. What it means that if he has an alternative connection like a home Wi-Fi, he can use this one. Okay. Of course, our service is based on network. So if the provider of this network, whether the fixed line or the mobile line is not anymore working, we cannot ensure the high quality of the video for sure.
Okay. So thanks for the minute. But now let's step further into the contextual communications topic.
Okay. So here is just a recap. I talked at the beginning in the product portfolio. You saw that Dr. Link was located inside a contextual communication. what does it mean? Contextual communication is the capability to enrich the classical communication, I mean, for example, a video call, with additional data that is able to provide to the two parties the context. How we address this one? So we start with what we know better, that is the real-time communication part. So the app of Dr. Link is able, with one click, to provide video call between patient and doctor. The app is designed in order to have a specific task to address emergency video call, to address something for urgent reason. We can, with the same app, and easily engage a second doctor, a second caregiver structure, and have a video conference. On top of this one, we have the classical service that are provided for the unified communication, like chat, file, and desktop sharing. This is the first entry point, the first service that is provided. To enrich this monitoring system, what caregiver need to know is the therapy. So usually patient is dismissed from a hospital and with a specific therapy. And so what they would like to know is whether the patient is following or not the therapy. And here we provide the solution. Inside the app, we have a simple reminder that reminds when to take the meds. And patient is supposed to flag so that a notification in terms of data is sent from tablet toward the caregiver, on the back end the caregiver, so that doctors are aware if the patient take the meds and when he take it. So a second way to monitor the patient, they can see him, they can check the therapy, and then we add the part related to the Internet of Things, mainly in the contextual communication. So we add remote sensor. Tablet play the role of, it's the main instrument to establish the real-time communication, but on top of this, it plays also the role of a gateway. So using Bluetooth protocol, we are interfacing different kind of medical sensor that are certified as a medical sensor, able to collect vital parameter from the patient. I mean, heart rate rather than blood pressure. We have integrated, and you'll see all the list, stethoscope and so on. So all these equipment are supposed to be given to the patient when it is discharged, so that patient can take measurement and then send data toward the hospital. So with this one, we are enriching what we call contextual communication with data, so that everything can be done together. So while the patient is watching, the doctor is talking with him, he can send data from measurement, he can flag when he takes the therapy, and we add also a questionnaire, because this is a feedback we got from the first pilot we made beginning of the year. Questionnaire that can be either medical questionnaire in order to understand whether the therapy is working well, which is the feeling of the patient, or technological questionnaire, meaning they could check whether this kind of technology is really helping the patient, which are the main benefit, advantages, and maybe if they face some issue.
Yeah, so I think at this point, time for a first question, first poll for our participants in our webinar. So time to work a little bit. So do you have a telemedicine solution in use in your organization? I'm going to start the first poll. Please give us a short click, yes, no, planned, or don't know, or no answer. So I think from your point of view, Stefano, how is it in Italy? Because in Germany, sometimes we feel that it's not so distributed a solution, a platform solution, especially in for healthcare providers. The first ones are checking it, telemedicine solutions, but it's a very complex system depending on the health service, the national health service, especially, and the insurance companies on the one hand, and the healthcare providers on the other hand. How is it in Italy?
Oh, I guess that for this point, this was one of the input we used at the beginning when we select the technology for the openness of the technology itself. Since we can have different rules in terms of regulatory moving in Europe, since we can face different kind of technology already in place with some of the services I was mentioning, our choice was exactly this one, to have something that was as much as possible flexible. So with the idea that we can use, integrate, easily modify, it is valid both for the sensor, for example, rather than for the different rules that we can encounter in the different countries in Europe, for example.
Okay, so last appeal to our audience, just give us a click. Do you have a telemedicine solution in use? Yes or no, or planned, or don't know, no answer. Please send us your click now in this moment, and I will close the first poll in a few seconds. Just let's wait a few seconds, and then here we go. Here are the results. Yes, 16%, no, 58%, planned 5%, and don't know, no answer. Every fifth participant says don't know, no answer. So a few have. Stefano, what's your comment to that result?
Sorry, I didn't catch very well. Could you please just repeat? There was a noise in the voice.
Yeah, okay. So yes is 16%, no 58%, planned 5%, don't know, no answer 21%.
Yeah, the feedback is more or less in line with what we were expecting, and so 60%, it means that we are going to face a different environment with different product and with different technology. And so again, the choice we have made on the product is, I guess, the right one to be able to be integrated with this different platform that maybe, I guess, we will see later on, maybe they are addressing some of these services, but not all the services. Just one word to connect to this one, and then we will move on the next one. Each of the services I'm talking about, at the beginning I said open platform. Each of these one, they are modular services. It means that the final services of the caregiver can be built based on their need. So we can have scenario where sensors are needed, and we can have scenario where sensors are not useful, and maybe the therapy management and the quality of video is far more important than the sensor.
Okay. So let's have a closer look on the use cases you're going to provide.
Okay. Here is the idea. So we talked at the beginning. The idea that the first step is the hospitalization scenario. This is because it has, for sure, from human point of view, for the patient, a remarkable impact. But it has also an impact from economical point of view, because we are somehow having beds available in the hospital in advance, while we are able to monitor the patient. Then there is another use case that is really more important, that is the use case related to the chronic disease, because here the driver is the time, because on this scenario we are going to monitor patient for a long period, maybe months, maybe even more. So here the impact on cost and on quality of life for the patient is really important. So being able to provide a platform that ensures all such kind of monitoring with video, with all the services we were talking about, is really important, both for the patient and also for the caregiver, for different reasons. Of course, there are also some scenario we will see later on for one pilot we are addressing, where remote checkup can be addressed too. So we can imagine different point of presence located in a country where people can go there and perform some checkup remotely instead of reaching the main hospital that maybe is far from their house. And then, of course, there is all the topic that is related to the biodata and all the information that are collected from this sensor. I said we integrated different sensors. We will see which one in details. And all those remote and biomedical sensors are certified, meaning we are collecting and transporting transparently those data from the patient to the caregiver, to the hospital. So it is something that is done automatically, so we are avoiding any kind of problem, mistake, so that it can be even used as a platform to collect information while we are monitoring, for example, a specific therapy for a patient.
Stefano, we have two pretty interesting questions at this point of your presentation. So the first one is, how is the alarm going to be triggered if a patient is not following the doctor's therapy plan?
Okay, for the therapy, of course, here we have the human interaction for sure. So what happens is that as soon as a therapy is loaded on the tablet, and of course it can be updated during the time remotely, as soon as it's loaded, a reminder at the right time with the right meds to be taken appear on the screen of the tablet. So that which is the action from patient side, patient is supposed simply to tap on the screen on a simple icon stating, I took the med.
Okay, and the second question, yeah, so the second question is, how do you make sure that no threats can be made over the Bluetooth devices?
What do you mean inside the house of the person? Okay. The idea of the tablet starts from the idea of having a big screen with a selected tablet with a good camera, and on top of this one, we provide what we call hardenized tablet, meaning that the tablet is completely hardenized so that no other process or application can run on the tablet. So neither patient or a third person can use this tablet for a different reason than the Dr. Link app, so that you don't have access to any tools, any setting in the Bluetooth, anything inside the tablet, because it is somehow blocked, and it will work only for the Dr. Link app. And the Bluetooth association between tablet and sensor is already done before discharging the tablet with the patient. Okay. So the patient is provided with tablet and Bluetooth already associated.
Okay, so when we summarize it a little bit, so you have a network idea behind this whole solution, is it correct?
Yes, absolutely. So we will see, maybe, I guess, in the next slide, there is a recap, this one, there is a recap of a network sketch, just because we talk about the different feature and the different behavior, and now we will move on the three main side of our solution, of our product. So to answer to your question, here we have a network sketch that summarizes what I said till now. So we have the hospitalized patient that is at home with tablet and, if needed, one or more remote sensor. Then we have on the top of the slide the centralized nurse room. So here we can have even a sort of video contact center that is receiving call and dispatching the call to the different and the right department inside the hospital. And then we have on the top left of the slide, we have the Italtel service center. It is this one, I would say the service center that take care of the technological part of the solution. So it is the monitor of the overall solution, meaning the platform installed that can be installed either on cloud or in the data center inside the hospital. So I said at the beginning, Dr. Link is a software-only solution that can be provided both on cloud, as it was depicted in the previous slide, or if needed, it can be locally installed, as we are doing with one of our customers, inside the data center of the hospital. So those are the three main elements.
Yeah, Stefano, I think we should have the second poll at this moment. So sometimes I think it's a challenge for a healthcare provider or an IT specialist working for a healthcare provider. A big challenge to integrate such a solution in this everyday business. So the question to you as our participants in this webinar is, where do you see the biggest challenges in integrating a telemedicine solution in your business? Is it data protection or security? Is it regulatory constraints, budget, internal skills, or other challenges? So please provide us our click now so that we can discuss a little bit. So from your point of view, as a provider for a solution like that, Stefano, is data protection a big issue, especially for your clients, or is it only a German point of view? Stefano?
Yes. On my side, I guess that concerning the topic of data protection and security, we think that both of them, since we are talking about healthcare domain, both of them are need to be seriously taken into account. That's why for data protection, we are talking about cloud deployment with all the rules that are defined for storing this data on cloud. And for security, one of the other driver that let us know select this technology is security. WebRTC technology is a technology that can work only with encrypted communication, meaning that all the communication that is performed between patient and doctor must be encrypted. So there's no way to perform a video call, there's no way to perform even a chat between patient and doctor without having this chat encrypted, meaning that everything is somehow secure in terms of communication. This is one of the added value of the communication that we are providing in respect of the standard tool and software used for the communication.
Okay, let's close the second poll and have a closer look on the results. So here it is. So we have 72% data protection security. So our German participants have a closer look on this topic, 22% on regulatory constraints, and the same number for budget, and 17% for internal skills, and other 22%. So when you see this result, I thought budget would be a big issue far more than the result is showing up here.
Yeah, I mean, for data protection and security, I was expecting this number. Concerning budget, maybe different product and solution like Dr. Link First are coming with a reduced budget. So here, for example, we are talking, I said at the beginning, of products that do not need any hardware specific requirement, do not need any software specific installation. So I was expecting this figure concerning the.
Okay, so I think it's time to have a closer look on the patient side. So what is he going to see, and what is it going to what does it look like?
Okay, here is some screenshot. Here is the screenshot of on tablet side. So the app we designed for the patient was designed with in mind simplicity. So the idea that the people that maybe are even old person, they are not used to technology. So this assumption was used to define all the solution. We don't need to transport complexity of the technology on patient or on doctor side. So a simple app that can be fully customizable. So this is one of the example you see of the layout with one button only. And once you press this one, you have the specific option. So based on the dismiss that is done of the patient, so I mean whether he has a therapy, whether he has a remote sensor or not, pushing this button, it will appear just the few buttons that are associated with this profile. So with one click only, the patient can click on doctor icon and perform a video call directly from the tablet to the PC inside the browser of the caregiver that is remotely connected. So here on the right, we have just a recap of what they can do. So I'm talking about the video call for sure, the biomedical sensor with the collection of all the data. Here, by the way, we talk about security, but also reliability, since we are talking about healthcare. In this scenario, if for any reason, and I'm connecting to the previous question, if for any reason we have an interrupt in terms of data connection, what happens is that all the data that can be either a questionnaire or a remote measurement are locally stored on the tablet. And then as soon as the network is back to life, all the data is sent toward the caregiver. So this is a way to store the information when we have some issue in the mobile or the fixed network. So here is a recap of what on tablet side a patient can do. So we're talking about the chat, the therapy, and so the way to monitor the therapy, and then some questionnaire that can help better tune the application on one side or for medical reason the therapy.
Yeah. Do you have some examples for? Yeah, here it is for integrated sensors. So we have them on the next slide. So a stethoscope, spot monitor, bodyguard sensor, and so on.
Yeah, here is just a quick view of the sensors that are integrated, and just to one important point, I talked at the beginning about the flexibility. Flexibility means that we don't know which is the best remote sensor that need to be integrated to monitor a specific therapy. So we are experts in telecommunication, we are not doctors, meaning that the main challenge for us was to use this technology in order to be able quickly, I mean in terms of weeks, to integrate a new specific sensor that maybe is requested by our customer. Here, the slide is spread into, on the top, we have the certified medical sensor, we have an electronic stethoscope, we have a spot monitor that is somehow an hub with different sensors that can be connected. We can collect information concerning glycemic value, blood pressure, temperature. We can even perform an easy ECG. And then we have an example of a more small sensor, the one on the top right, that is a pulse oximeter. All those sensors are certified medical sensor as a medical device and can be interconnected with our tablet that is able to collect all the data, store it, and send it to the caregiver. On the other part,
excuse me, Stefano, there's a question from a participant. What's the fee model from the point of view of the patient? Is there a flat rate or cost per call or number of used modules or sensors?
In terms of patient, yes, we can define, I would say, different profile, because as I said, it is modular. So we can imagine to have a solution, we will see in one of our reference, where the need is to just provide the capability to have HD video call. And so the tablet is enough without any sensor. And this is one package with one profile, with one price. In this case, for example, the request was done this way because the need was to perform remote medication. So there was no need to have any remote sensor, but the patient was requested to perform auto medication, and the video, the HD video quality was used for the doctor on the other side to check that remote medication was done in the right way. Of course, we can build different bundle. And the bundle is based on which kind of services you need, so whether you need or not sensor, and how many patients you are addressing in the specific structure. I was talking about the other sensors that are mentioned. In the use case, we talk also about social environment, because I always use the word patient, but instead we can imagine that, and this is one of the market we are going to address with our solution, we can imagine to address also the social impact of aged people. That is a common problem not only in Italy, but in whole Europe. So a way to keep an eye on old people. And that's why we start integrating even some sensors that are not or not yet certified as a medical sensor, but the doctor need or caregiver more generally need to know which is the health status of the old person. For example, we are all facing the explosion of wearable device, and despite the fact that these wearable devices are not certified as a medical sensor, they can give you an idea of, for example, if a person is walking, is doing the right walking and right, I would say, gym exercise during his day. So together with certified sensor, this one can provide, always linking to the contextual communication, the right context for the person that is maybe alone. Here we have different use cases, and some of these one even go outside the perimeter of the health. For example, the bodyguard sensor. This bodyguard sensor is a small device that can be attached to the belt of the person, and it can detect once this person falls down. So we know immediately with an alarm that is generated from this sensor and that reach immediately the caregiver, we know that this person is fall down. So we know how it fall down and which is his status. So those stories just to let you understand that given the flexibility, integrating specific sensor that can be either body sensor or environmental sensor, we can really perform an effective monitoring of the person.
Now let's step further on to the doctor side.
Yeah, here is what we have on doctor side. On doctor side, I said we don't need the specific software, so we are just using your web browser. We don't need any specific operating system. So if on the caregiver side we have Mac rather than Windows or Linux, we don't care. Which are the possibilities? So here on the screen you see that on the left we have the real-time communication part. So inside the browser you have all the capability to see which is the status of the patient. So whether it is online or offline, you can chat with him, you can send file to him, and with one click you can perform a video call with him inside a browser. So we have also an additional feature that is the recording feature. Since, and here I'm connecting to the rules defined on Europe for example, for the therapy, what happens is that since you are not close to the patient, you can imagine to have a check, an health check with the patient with a video call and record all the session. It means that at the end of the visit, you will have a file, a video file that stores everything. For example, that stores the upgrade on the therapy that was done by the doctor to the patient. This file is automatically saved on the cloud or on data center based on where Dr. Link is installed, and an additional copy locally on the PC of the doctor. What happened in terms of data? I said we have two different options. The first one, the main one, since considering the answer we got 60% of people answer they already have some part of this solution, we can imagine to already have a folder that is storing all the data of the patient. What happens is that Dr. Link can transfer all this data inside the backend and the clinical folder that is already there on the caregiver side. So we will add the real-time communication and we will send the data from sensor toward this folder. On the other side, we have another option that is provide our own folder. So it is a dedicated folder strictly connected to Dr. Link that is able to store all the data coming from the sensor, all the private data of the patient together, so that on medical staff side they have access to the status of the patient. They know whether it is online or not, and they can access to their clinical records, so they can check if he's following the therapy because we got the flag. They can check all the remote measurement he made because patient can perform using the remote sensor the measurement while he's talking with the doctor or in a standalone mode during the day. So here comes back the topic concerning the flexibility, so the capability to use and to integrate our solution, our product inside a network that is already there for sure.
Okay, finally, this service center side. This one, this slide showing up the dashboard from the user side, from the healthcare provider side point of view, or is it the healthcare center at Italtel?
This one show the view of the Italtel service center side. Mm-hmm. What happened? I said at the beginning that one of the key points for this technology is being able to keep it simple for both doctor and patient. And this is the idea we got with this platform. This platform is in charge to Italtel service center that is used historically to monitor big network of big service provider, 24 hours per day, 7 days. Meaning we somehow inherit this philosophy inside our solution. So what do they have today? Today they know where every tablet for this specific deployment is located. So we have geolocation of the tablet. And to be compliant with privacy, we don't know the name of the patient that is using this specific tablet. So we have some reference with tablet number 1, tablet number 2, but we don't know who is using as a person. We know where it is located, the tablet, mainly for security reasons. So in case of any trouble, any emergency, we know exactly where it is located. We know which is the patient status. And more than this, we are monitoring technologically the platform. So on one side, we can check which is the status of Dr. Link deployed either in the data center or in the cloud. On the other side, we are monitoring all the equipments. So the tablet, we know, for example, for each tablet, which is the level of battery. Because all this solution and all what we are discussing today, it could become completely useless simply because patients forget to put the power supply on the tablet. So everything is working fine, but one stupid thing like the power supply can isolate the patient and we are not anymore able to be in contact with them. So we cannot leverage the caregiver or the patient. And so this is why we have a platform with a dashboard that is able to monitor the battery status, both of the tablet and sensors that are connected. We know which is the level of the signal. At the beginning, I got the question concerning signal interruption. We know exactly which is the coverage area. We know exactly whether the tablet is using a local Wi-Fi or a mobile network. We know which is, for example, the amount of free space available on the tablet, because if we are experiencing a long isolation from the network and data are stored locally, we know which is this level. So in one word, we are really monitoring all the technological part. So we know in advance if something happened. We know in advance whether some patient is not anymore connecting since hours. So from patient and from doctor, they all know that they have one single point of contact, that is Italtel Service Center, for any technological trouble.
Okay, so just to summarize, Stefano, because we have 48 minutes now and we just wanted to finalize it a little bit. So we have an open healthcare platform, we have a software-only solution, we have an easy IoT devices integration, simple and easy to use, and we have platform and devices monitoring, just to recap it a little bit. So, and one question is from one spectator, who is going to pay for the medical equipment and possibly services for the patients? Is this the patient paying, or is who is going to pay, or the insurance company?
Yeah, we can have different scenario. One scenario is linked with the insurance company that will enter in a win-win scenario, where they could pay less the hospital in order to have dismissed the patient in advance. We can even, I didn't say at the beginning, but both private and public structure can take benefit from this one. So even on a public structure, if they say that they have a real advantage having anticipated admission of patient, they could leverage this technology that is really light and can bring added value. So the idea is exactly this one, to have structure, or it can be sold through a service provider that can provide this kind of services to their different customers, like hospital, private, or public.
Okay, before we step into the next question from our spectators, from our visitors, A last poll for you. Are you planning to invest in a telemedicine platform solution in your organization? So here is the questionnaire. In the next 3 months, in the next 6 or 12 months, or no actual planning, or the topic is generally interesting, but there's no actual planning at the end. So if you provide us your answer in this moment, meanwhile, I could ask the next question from a participant, Stefano. The question is, how is a patient going to be identified? Dr. Sensor could also be worn by someone else.
Yeah, here, for example, being not in the hospital, of course, we are running some of these risks. But for example, today we have technology like fingerprint, we have technology like face detection. So those technology, from our point of view, are completely transparent because they are relying on the hand side. So if tablet is equipped with fingerprint and then even with face detection, we can somehow ensure that the people that flag the meds taken is the right one, is our patient.
All right, so if you in the audience could provide us the last click, and then we could finish this poll. So some spectators don't want to click in the moment. Maybe we have some seconds for you. And just to step into the results. So everybody is waking up at the end. And we have some use cases at the end for you just to finalize the presentation, and time for your questions in addition to that. So here are the results. In the next 3 months, 8%, no actual planning. So and topic generally interesting for 54%. So every second visitor, every second participant says it's generally interesting, and some are going to invest very soon. All right, Stefano.
Okay.
Use cases and success stories. So you have some use cases from practice, best practice examples.
Yeah, I will quickly show what we are working on. So the first one is a real project with a public hospital in Italy, where we are deploying a solution in order to monitor patient and provide them support for terminal ill. So Dr. Link, it will be provided in this scenario with external biomedical sensors. Some of sensors are already present, some will be maybe requested later on, so, and we will address with this new one. Then we have quickly a pilot project on an Italian hospital too, and on this one is the one I was referring before, is the one that is done to perform monitoring of and care assistance of patients that are discharged from the hospital and monitored. In this scenario, we are not using a remote sensor, and we are just using the video call to support them that are able from home to perform auto-medication. On this one, of course, is a key to reduce the improper also access to the ER department. And then we have another use case that is in South Africa, and this one is the idea of using Dr. Link in a different way. So we have to imagine different points of presence that are distributed on the territory that can somehow be used as a first port so that people can go there and use the tablet with plenty of sensors supported by nurse in order to have a remote checkup from hospital. This is an important point because it shows how Dr. Link can be used in a different way in a scenario where maybe people are far from hospital, 500 kilometers, and do not have access to all the public and private transportation that can bring them to the hospital. So this is a different usage, and this is a pilot we are going to start soon in this month in South Africa. Just to close, in February of this year, we were presenting our integration at Mobile World Congress, where we show how Dr. Link was easily integrated inside a third-party folder provided by Exprevia named eLife Care. So all the services I just described here were fully integrated inside a clinical folder already deployed on many hospitals, giving to this folder the advantage and the added value of the real-time communication embedded in the platform.
So very interesting. So at the end, what's next?
Yeah, just to close, what we are looking for the next future. So the first step, it will be the integration with the blockchain. So we are talking about data related to patient, and we need to be sure that those data are not impacted, not modified, and accessible only from the right person. We will move on this scenario for sure. We will improve the voice evolution through the integration of voice instrument used to interact with the patient when it is not able, for example, to write or to use the tablet. Chat box, the topic of people safety, because this app can be even installed on a smartphone and so be used to monitor people that are working in dangerous places. And of course, the big leap will come with the 5G network evolution and, for example, all the sensors that are based on tactile internet.
So at the end, so there are the contact details, and maybe at the end it's important to clarify a little bit that Italtel isn't selling the solution directly to the patient, but to healthcare providers. Is it correct, Stefano?
Yeah, absolutely, yes.
And another point is regarding the sensor. Italtel is open to integrate any sensor present in the hospital, and we aren't. Italtel is not a provider of sensor, but the list that Stefano is showing here, that those sensors are sensor already certified with this solution. But Dr. Link, of course, is open to integrate anyone.
Absolutely.
Okay, so at the end, thanks a lot, Stefano. It was quite interesting just to see how telemedicinic solutions are rising up and emerging in countries other than Germany, because sometimes from Germany's point of view, it sounds a little bit like future discussion. But when you see that even in Africa, you can use things like that, it's time to think over how especially after operation services in clinics and so on are going to be better in the future. And I think it's a quite good point just to start up and think about providing new healthcare services, telemedicine services in a whole new way. Thanks for that. Stefano, at the end, 60 minutes are full, and time for you to say goodbye to our audience.
Okay, I would like to thank you, everybody, for your time. Thank you very much.
Okay, and if there's any question in addition to that after this webinar, don't hesitate to contact Stefano at Italtel in Italy. A phone number 39024388746 or via email stefano.livraghi@italtel.com. Have a fine day, have a nice week, and go ahead and build your future solutions in your healthcare organization. Bye-bye.